I had North Carolina winning, so I was
That close.
close.
Next year, we've got to turn into some kind of blood raiser, game, I don't know. It'll be fun.
Yeah, it's a good tournament this year.
Yeah.
It was a great tournament. Okay, it's 4 o'clock. Let's get started. We'll call the Fire Territory, Warsaw-Wayne Township Fire Territory meeting to order. And we'll start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Observe a moment of silence. All right, thank you. Let the minutes reflect that we do have a quorum. 4 voting members are present. Jeannie Stackhouse from Wayne Township is absent today. So with that, we'll go to the approval of the March 1st minutes. Those were presented in your board pack. Are there any corrections to them, or is there a motion to approve them as presented?
I so move.
Thanks, Gordy. Is there a second?
Second.
All right. Any further discussion? All in favor say aye.
Aye.
Those opposed?
I'll abstain, as I always do when I'm not at a meeting.
All right. Motion passes 3-0 with 1 abstention. All right. Recognizing all our visitors. Good to see you all. Thank you for coming. We'll get started here in just a moment. I'm certainly pleased to be at this meeting with our new chief. I did miss the meeting that he was presented to you all, and I know he's been working hard. We've met quite a bit, and I know he's meeting with everybody and doing a good job his first month, getting his feet on the ground, and I think he's probably much more prepared for this meeting than the last one, so
Yes.
we're certainly glad to have you here, Garrett, and
Appreciate it, thank you.
continued success as you move along. So with that, we will start with the reports, oral and written communication. We'll start with Lutheran Ems. Hello there, how are you?
Good, how are you?
Good, thank you.
Good. All right. So in front of you guys have our February report. You'll see in the month of February, we had 446 encounters. You'll notice that that number is drastically changed from January. With our COVID numbers and the way that seemed to kind of nationwide down, and so we've been more consistent to what has been normal for us. So 446 is the total numbers of service. You'll see as you go through and you look at our times, again, our patients are staying locally, and you can see that through our transport times, and then getting back into service. One of the things that you will notice is that our return to service time was a little bit higher, just by a couple minutes this month. And one of the things that we looked at was the reason for that being. And so we found that actually this month, even though our total call volume was lower, our critical level was even higher than it has been. So that's what plays into some of that, just getting supplies in the trucks and things of that nature back in service. So if you notice that, that's what you'll see. And then as you move through the responding stations, you'll see again pretty consistent with our most common used station being our east side, where we have the 2 trucks that run out of Monday through Friday. And then our Warsaw Station 3 having our second largest call volume. That one that you will see from the Warsaw admin station, that was actually during a time where Tony and I were staffing an additional truck during some high call volume times to keep our Bourbon and our Milford truck in their areas. So we just added on a truck to keep those trucks in those townships and coverage areas. So Leesburg and then Bourbon and Milford, you'll see where those numbers fall. So pretty consistent for us as you kind of compare the 2022 with 2021 numbers. Again, just giving you guys an idea on the transport by hour and kind of what that looks like for our call volume. Our day shift, early afternoon, is continuing to be our highest volume, something that we're looking at our shifts and what time is best to make shift change and things of that nature. So, any questions with that?
Questions from the board?
We are very excited. We got the all clearance to start doing our PR events. We're going to be hosting 3 car seat clinics throughout this next coming 3 months through the summer. So we're very excited to be able to do that again now that we've been able to put COVID, hopefully, fingers crossed, behind us. So.
All right. Tell us a little bit about the car seats. Those are infant seats, or baby seats.
So we have infant seats, we have high back boosters, we have the 5-point harnesses. We get them through ICJI. It's a state-funded grant program that we apply for every year. And so we provide those to anybody within the county that either doesn't have a seat or needs some type of assistance in getting a seat. So we have partnered like with the police departments, and we get a lot of their references from there. I know Warsaw Fire does their car seat program, and we fund all the seats when they need a new seat through our facility. So,
Great.
Yeah.
Any questions?
So you guys are putting on the program, the days where you check them and give them away as well?
Yep.
Is it still like in the 90% range that they're installed in correctly?
So actually in 2021, when we did our end of the year statistics, 96% of the time, we had over 300 car seats that came through our clinic, even with COVID, through our appointments and things like that. But 96% of the time, we found at least 2 errors.
Wow.
If you drop that down to 3 or higher, because we record both of those numbers, we were still sitting at 42%. So, I mean, when you look at the idea of how many of these kids are unfortunately being transported in an improper position, it's a huge program for us. So, yep.
Good.
So we're very excited to be able to get out and start to do those again.
All right. Thank you.
Yeah,
Appreciate
thank you.
it. All right, Chief, you going to go through the monthly response for the territory?
Yes, sir. So the month of February, Warsaw-Wayne Fire had 273 calls. Of those calls, 58 were fire-related. That's a combination between house fire, car fire, any type of carbon monoxide alarms, vehicles via MVAs without injuries, elevator assist, so on and so forth. The major fire calls that we had was a garbage truck fire on the 30. That was a waste management truck. Trash fire on Columbia Street. Nothing too crazy, just kind of melted some paint on the vehicles. But the trash fire was not a big deal. The big one was the grain bin fire at Louis Dreyfus down in Claypool. That's where our truck went down. There was multiple agencies involved on that one. It was a 7-8 hour call. It was kind of a big one. A pallet fire, a storage box fire down there in Leesburg that we assist with, and a building fire at the Penguin Point on Lake Street. It ended up being like a stove fire. The oil got caught on fire, and they threw some extinguisher agent on there, so we had to have the health department response come to that. Moving on down, assisting.
Chief, can I ask you a question just real quick? I'm just curious about this trash fire on North Columbia Street. You say it's no big deal, but a lot of houses down there. Are people supposed to be burning trash? And
They are not. That's why we went and we put it out. But I was just making the point that trash fire did melt the paint on vehicles. So,
well, I wasn't calling you out on that. I was just concerned people are burning trash in town where, you know, it's houses close by and
It happens more often than you think.
okay.
yeah, that's just the one that we don't get called on a lot of them. It's, the police sheriff get called on most of them, but when we do go, it's we'll put it out. It's pretty windy around here, so, and there is a lot of houses on Columbia Street.
I assume we do have an ordinance on that, don't we, Mayor?
Absolutely.
Burning
Yeah.
trash?
Absolutely.
There's no open burning in the city at all.
Yeah. Okay.
Yeah, this is our enforcement mechanism. Put it out.
Yeah, and rightly so and good. I wish people would, anyway, thank you.
Agreed. Yes, sir. Assisting other agencies, we assisted Claypool amongst other agencies on the Louis Dreyfus fire. We had an EMS assist for Leesburg that ended up being no incident found, and an MVA on Kings Highway assisting Winona, along with an EMS call in Winona. And we received help from Winona once in the month of February. Moving on down for emergency medical response, we had a total of 166 EMS calls and 23 CARES calls, one that was out of Mentone. We didn't really respond to Mentone. We had Mike Wilson out there for a training, and it ended up just being a CARES call, so we took care of that one in Mentone. So CARES is picking up, it's getting busier, staying within the confines of the city. Medical calls are always picking up. The month of February was a big training month for us. We had 16 guys to go through HazTech school, so we have 16 HazTechs now. It was a big training month. It was fantastic. They did a great job. We're really proud of them. We had a lot of good response and feedback from the instructors that were teaching it for our guys. So another important thing that I'd like to point out is that out of those 273 calls, we had 90 of them overlapping, and most of those were in Station 1. So basically, call happens right after the other, where we have two engines on a call at the same time. This February we're just getting into public education with Max Kinsey and his public education. It's big time right now this month. We only had a few hours in the month of February for public education, but that'll be significantly increased with March and April because they're hitting the schools pretty hard right now. Other than that, that's all I got, sir.
Chief, you said one thing I just want to make sure everybody understood with the CARES calls. We're trying to keep those limited. I think you mentioned the city, but we're obviously, those calls are for the fire territory, which would
Yes.
include the township as well. We're trying to keep those calls limited to that area. And I'm going to have Chris give us a little update. He's coming up for an item here in a minute, and I'm just going to have him give us an update on the CARES program as it's obviously taking off, and administratively it's starting to gel. So, but thank you, appreciate that. Any questions on Chief's report? All right, let's dig into the expenditure reports. These will require an approval. We'll start with the operating fund, 2243. You've had a chance to look through that. Chief, are there any large expenditures you want to draw our attention to?
Nothing in particular. Like I said, we had the hazmat class was a decent amount of overtime for the guys just because of the amount of people that were involved in it. Other than that,
Okay. All right. Are there any questions? If not, is there a motion to approve the operating fund expenditures as presented?
I'll make a motion.
Okay, thanks, Mike. Is there a second?
It was actually,
Oh, I didn't look up. You guys kind of sounded the same.
I'll
Right.
second it then.
All right, very good. Did you get that, Shirley? Sorry about that. All right, any more questions? All in favor, say aye.
Aye.
Those opposed? All right, pass 4-0, thank you. And then to the equipment replacement fund. Again, require your approval. Doesn't appear that there was any significant expenditures there. Some gear.
we'll add that the equipment and the repairs are mainly from the ladder truck getting repaired. That's taking up some decent money right now.
Any
Questions?
idea on a completion date?
I did not. I have a call into Damien for for an update. It's in Indianapolis right now getting repairs done because the proprietary software that Pierce provides, we can't fix it here. It's got to go to them.
Questions?
Make a motion to approve.
I'll second.
Thanks, Mike. Second, Gordy. Any further discussion? All in favor, say aye.
Aye.
Those opposed? All right. Chief, before we go into new business, would you just give everybody an update on the tornado sirens? I know we had a little bit of difficulty and finally got everything rolling yesterday, so you want to...
Yeah, so we've been working on it for the past couple weeks. We obviously wanted to get it hammered out before tornado season, which we're kind of already peeking into, but we did finally get it fixed. I want to thank the assistants to dispatch and J&K Communications. There was a problem on the J&K side with communicating with our DTMF tones. It was just incorrectly inputted in their systems, but we finally got it figured out yesterday. As I'm sure you all heard the sirens go off a few times. So we're back to being in business with them, so we're good.
Yeah, I know we had a couple planned sirens that they didn't work, so we decided it was better to get into the point now where it was better to just test these things while the individual was there working on it. And it worked out, so we're pleased that they finally got going.
Got to hear my first one. It's the first time I ever heard it.
Not many tornadoes in Phoenix.
We don't have that stuff.
Hope it's only a test.
Yes, me too.
It was a test. All right, so they're working, and that's a good thing. All right, no unfinished business. Let's dive into item number 1.
Dive into that.
Drew, you better come up here before it gets out of hand. Thank you.
Hello. So as you remember, last year we hosted Dive Rescue International for a series of classes, and they went over really well. We had, besides our guys, we had divers come in from as far away as Massachusetts, New York, Tennessee. So all the instructors were really pleased with what we have to offer here as far as hosting classes. So we decided to try it again this year, so that's why I'm here to get your approval. This year we're looking at hosting 3 classes, and they include Hummingbird Sonar Technician, which is, the dive team has 2 Hummingbird Sonar units, and this class teaches all fine-tuning, operation, interpreting the images that you get on the sonar. We're also looking at hosting Light Salvage and Recovery, which is cargoes in the lake, which we've had a few times. Snowmobile's going across the ice and falls through. You know, after that rescue is made, you still have the problem of recovering the snowmobile or the car or whatever, for environmental reasons, obviously. And this class will go over using the lift bags to raise that up and be able to get it out of the water. And the last class is hazmat diving, which is going to sound bad to say this, but all of our lakes have some sort of contamination, whether it's decomposing plant matter. If it's a recovery, there's decomposition going on, and we have to be able to learn to recognize those hazards, protect our divers against that, and that's what this class is, the decontamination after we get out of the water. And again, besides the registration fees to put our divers in the class, it doesn't cost us anything to bring Dive Rescue International here. They provide the instructor, they take care of the airfare and everything. So it's a real good deal for us. It saves us money and not having to send our guys out to different locations. And again, it brings people into the city. So again, I'm just here to get your approval to host these again.
Would you talk just a little bit about the economics of this? I mean, we're certainly saving money by hosting, and I believe, are all the instructors members of our fire department, or do you bring other outside instructors in?
Dive Rescue International provides all the instructors.
I see.
Last year we had instructors. It's actually the dive commander from Indianapolis Fire taught a couple classes. We had an instructor from Florida come up. So they take care of the costs of getting all their instructors here. They pay the instructors. They take care of the hotel and everything.
And we're allowed a reduction in the fee?
Correct. For each class, If there's 10 filled spots, we get 5 free spots. So that's a pretty big savings.
You know, it's saving us our travel.
Yep,
Yeah, it's a really good deal.
yeah.
Very appreciative of the work you've done on this.
It's good for the city too.
Yeah, well, absolutely.
Restaurants, hotels.
Yep. Well, I appreciate all the work you've done on this and having pulled the event off last year in a successful manner. I'm sure you're anxious to try and outdo yourself again
Yeah,
this year.
I was talking to the dive commander from Indy Fire today, actually. He's hoping to be able to get 3 of his guys in the sonar technician class, so they're already looking to fill up.
Great. Question?
I was just gonna ask who else has got interest from around here? Is there anybody else expressing interest?
Well, we have quite a few of our guys looking to get in. There's another local department that has expressed interest in starting a dive team. So if they can get their guys through Dive Rescue 1 before then, they'll be able to put their guys in some of these. So, and then I don't know if the county has guys available or city PD. There's always spots. So
Great. So it looks like you've got the dates all hammered out and
yeah, there's quite a bit of information there. I don't know if you had a chance to look through it or not, but it's going to be from August 13th and run through August 20th.
it looks like the majority of work is in the Fireman's Building, Bike Lake, and then Warsaw Community Pool. Is that
Yeah.
correct?
Yeah, the high school allows us to go in. We've already talked to them. The dates we need are already available, but they're really good to work with. Not only for this, but throughout the year when we go in to do our annual skills refreshers. They always are really good about letting us in. So.
All right, anybody else? If there's no further questions, there's a motion to approve the hosting of the Dive Rescue International class this summer.
I'll make the motion.
I second. Give it to Gordy.
All right, appreciate it. Any further questions of Drew? All right, all in favor say aye.
Aye.
Those opposed? Drew, thank you again for your work.
Thank you.
Very much appreciate
Yes,
it.
thank you very much.
All right, let's get through travel requests and then we've got another kind of walk in here. So it looks like the travel requests are listed for you all to see. Questions? Is there a motion to approve the travel request as presented?
Also move.
Thanks, Gordy. Is there a second?
Second.
All right, any further discussion, questions? All in favor say aye.
Aye.
Those opposed? All right. So earlier I mentioned CARES program is taking off from an operational standpoint, and administratively it's also taking off. With that, I'd ask Chris Vansel to come up and he's got a request for us. Chris? And then, again, I'd ask if maybe you just give us a little update on how things are progressing on both
Absolutely.
sides.
So the reason this isn't in your packet is we actually, we met with the mayor a couple of weeks ago, and we had a good discussion with the new fire chief and talked about the CARE program and the CARES program and what that means and what we're trying to do with it. It became pretty obvious that there was going to be a little bit of a startup cost in addition to the salary of the employee. We hope to put in that position soon. I know Chief Holderman's been working with HR and the mayor to get that position set out, so we're hoping to get that done pretty quickly. But the overhead cost we came up with was, in the conversations we had with Warsaw PD and the prosecutor's office and Bowen Center, we really want to protect our people. That's number one. We have to be safe when we go out on these mental health crisis situations. And then we also want to protect ourselves from liability. So a couple of things we came up with was body cameras for our CARES people. So they're collecting audio and video to protect from that liability issue. Possibly putting cameras in the vehicles if we get to the point where Fisher's got to, transporting people directly to Bowen Center, which we're working with them, and I'll come back to that in a minute. we want to be able to protect ourselves. We don't want any he said, she said type of incidents, and we want to make sure we're above board. So, and looking at those and the software that it takes to run those, we met with Warsaw PD and kind of got their input on that. And then we also talked about even vests for underneath shirts. Currently, the fire department wears vests outside their uniforms. They're great, certainly a great safety part there, but one of the things we found from Fishers was that anxiety going up with police officers and the way they dress and the way they appear. So we still want to keep our people safe, but we don't want to look like police officers. We had an incident just today, actually, where we were great with a gentleman. He was even having some issues with some anxiety. We were having a good conversation, and as soon as we walked outside and PD was there, his anxiety jumped about 1,000 points. And so we want to be able to be safe, but we also want to just have that kind of concealed. So those are some of the costs we're looking at. Some medical equipment that goes with that, just very basic things that we're already utilizing. We borrowed a stair chair from Lutheran Ems to use, which is basically a chair on wheels that can go up and down stairs a little easier. So the total cost of that was about between $15,000 and $20,000 as we added up. And the reason this is a late request is because we met with K-21 yesterday. The mayor wanted us to really sit down with them because he felt they could play a role in this. They're certainly interested in helping us with these equipment costs. So what I'm here to ask you for, pointedly, long story short, although it seemed really long, is to make sure it's okay with you if we apply through K-21 for a grant that would cover these startup and equipment costs. The mayor had the foresight to use ARP money to hopefully pay for the salary of the individual, but really we're looking at the equipment is what we're looking for. K-21, while they are not traditionally willing to help with staffing or salaries, they're certainly willing to help with that equipment that we're going to need to get up and running. So their next deadline is May 1st, so we're kind of up against it. I don't have a problem getting everything to them by May 1st, but I need you to say that it's okay with you that we pursue that. Certainly before we would accept anything, we would come back to you with that proposal and make sure that everybody's okay with it. But just to get the process moving, we wanted to ask your permission to apply for that grant. There are state and federal grants out there that we're also going to be pursuing. As I was explaining to Chief Holderman just before we came in here, we're on the docket for the Mobile Integrated Health Subcommittee this Friday in Indianapolis to get their blessing to be a mobile integrated healthcare provider in the state of Indiana. That is step one for us to pursue that grant opportunity at another level. So as I spoke with the lady in charge of that program in Indianapolis, she said they haven't turned anybody down yet if they've got their stuff in a row, and we certainly do. We've got all of our protocols and policies turned in, and we've already got our application to them about a month ago. So we're hoping that we get that blessing on Friday and we move forward pursuing other grant opportunities. So I'll stop there. And then as far as the CARES program, as the mayor said, it is crazy right now. We have been responding all over the area in our territory. We've made a couple of responses to assist the county with certain situations that they've asked our help. It's kind of hard to turn down a request, especially say on a child who's in a mental health care crisis. I am not one that says, no, I'm not going to do that because it's across the line. We certainly try to stay within our territory because that's our number one responsibility, and we're certainly doing that. But it's kind of hard to turn it down when it's, we're human beings and we want to help people. So we do respond occasionally outside of that area. Very rarely, but I think in talks with Kyle Dukes over at the sheriff's office and some of his officers that this program eventually will, maybe the county will have a version of it that might run parallel to what we're doing. But we are certainly piloting it, and if our results are anything, it has been unbelievably helpful to this community. We've got great relationships we've already built with Bowen Center and Fellowship Mission, the hospitals. We're just developing handshake relationships all over the community to get people resources they need and to get people the help they need. Warsaw PD has started using us more, which is great. Like I said, we've been out today on situations. Our numbers just keep going up. It's been great. And I know the mayor, we talked about this a little bit when we were talking with K-21 about where we've been and what we're doing and where we're going. And my hope is that soon we can get somebody full-time into that care slot so that we can really even push farther forward. because this community is blessed with a lot of people who want to help, and those are the relationships that we're really getting into to make sure that we have those calls that we can make. I can't say enough about the people that are stepping up for us. It's been great.
Let's entertain the motion to approve application for the grant with K-21 first, and then we can dive into questions on the program.
I'll make that motion.
Is there a second?
I'll second
All
that.
right, any further discussion? All in favor, say aye.
Aye.
Those opposed? I do want to mention, it was really helpful yesterday to talk with Rich and K-21, and they have, I think, a very keen interest in behavioral health matters in the community. And again, this is obviously right in their wheelhouse with what we're doing. So appreciate their taking a look at this and seeing if they would be willing to help. So I think you said the May 1st is their meeting. So
Yes, sir. Well, that is the deadline for applications, and I don't know, usually within about 2 weeks after that, their board gets together and decides what they're going to do, but we will certainly have as most of you know, I'm pretty familiar with their grant process at this point. So we'll pursue that and then get that turned in well before the 1st and see where it takes us. I'm hopeful. I really
know
am.
I've spoken in the past about this program and the fact that we've been deliberately taking our time to make sure that when this rolls out, we've got our partners aligned, not just identified, but aligned with what we're trying to do. And I feel very, very confident. Chief Wilson and Chris have just done a marvelous job developing and developing those relationships, but more importantly, identifying, those resources that in crisis situation, that's our role, is to identify and try and triage, if you will, utilization of those different community resources. That was the lesson that Fisher's passed on to us. Don't go too quick. It's going to take some time. Again, you want not only partners identified, but resources ready to go. And Chris and Mike have done just a marvelous job getting us to this point. Mike will be gone in a few months, and Chris has other things to do, and we need to get a director of this program identified and hired. So, again, kudos to them. Questions from them on the program and where we're at right now.
I just want to acknowledge that it's just fantastic, the work that has been put into this and how much you clearly care about it. It's just awesome to have that kind of resource in the community, and former Chief Wilson as well, putting the time into this. I was a little skeptical at first, thinking, we're gonna take guys off of fire trucks, which we don't have the ability to do, being shorthanded. But when we're able to supply that kind of a need without taking firefighters off of trucks, man, I just see this blossoming into something that's great for our community.
Well, you said about everything I was going to say. I thank these guys, and this community is darn fortunate to have these guys doing this, and the mayor, and it's a great program. I don't know how much the community realizes it, but it's true.
I think when we first met with Mayor Fadness, it really struck me when he said, mental health is the kind of the elephant in the room. Nobody knows what to do, how to do it, and by having a great resource in our fire territory and their medical training, the fact that their uniforms are maybe not as intimidating to someone who's having a problem makes this just the ideal place for this to happen and occur. And again, destigmatizing mental health issues is important. We've talked about that as eventually something we'll also be able to do. But just providing that resource for the community when there's mental health crisis, when there's suicide ideations, and folks just having a difficult time, we've got a resource. And the idea is to then bring to the table those community partners that we can pass these individuals along to, and make sure that everything is still going okay for them So,
And Mayor, along that same line, speaking about a community partner, I think we really want to extend our appreciation to K-21 Foundation for stepping up and helping us financially.
well, yes, and that will happen now that we have the chance to apply. So we're very appreciative. We had a great talk yesterday, and I think their representation was very understanding of what we're trying to do.
A couple of things I do want to add to that is a couple of extra things that have come out of this is we've developed a scannable QR code with smartphones, and in partnership with Fellowship Mission, we're getting that out into the community, and it is a resource web page. If you need help with addiction, you need help with home repair, you need help with food, you need help with those things. We're getting that
Medication
out,
assistance.
getting that out to law enforcement so that it's going to be hopefully on the back of police officers' business cards. So as they make contact with people who maybe don't need a CARES person, but they need some other resource, or if they do need a CARES call, there's our phone numbers on those cards, and then that QR code is available to get that resource list out to people's hands. In kind of an interesting twist yesterday, we realized that K-21 had been working on a similar list, and so now we're going to join forces with them and streamline that process so that it's one thing instead of two. Because why reinvent the wheel in that thing? They were excited to hear we were doing that, so we're going to try to partner with them. Bowen Center, we've worked with them to get to the point where we're perhaps going to be able to do a FaceTime with a intake person at Bowen Center in Pearston, and maybe even do medical clearance using our medical training so that they don't have to go to a hospital first. So that could save thousands of dollars for the patient, could also save those resources in the hospital. So we're working hand in hand with them to get that done so that we can skip that middleman. We've already agreed in a loose discussion to, following in Fisher's footsteps, to go as far as Pearston with that person to an inpatient facility if they need to. And that way we can come right back and get back in service. But that would keep law enforcement from having to do that transport as well to get them back in service. So those are things we're working on. And I really foresee that becoming the future of what we're doing. And that way that we're saving these people thousands of dollars and those resources that could be better utilized somewhere else. So, like I said, the key to this grant is keep us safe, keep the people safe, and just, move forward. So I appreciate your time.
Quickly mention, I think Eric Lane in Fellowship Missions gets a big kudos for this QR code.
Yes, so they had developed, Eric, in one of the systems of care meeting that we have, that is a group of all the resources that want to be helpful in this community, and there are a lot. We are blessed. We get together and talk about new initiatives, new things we're doing to help the community. And Eric brought this idea of a trifold brochure of resources. And part of the problem with anything that's on paper is that it can be outdated rapidly. And we all know that not-for-profits, sadly, don't all survive. And our concern was that you would call for help, which is a brave step. I mean, let's be honest. When somebody literally says, I need help, and they reach out, if that person doesn't answer, they might not reach out again. So our concern was making sure that was a dynamic list. We came up with this QR idea. Eric loved it. Eric, I love that guy, just took off with it and developed this webpage through 180 Media here in town. And then when we actually got together and talked about some things, he offered to let us kind of take over the administration of that website. So it has become a partnership between Fellowship Mission and the Warsaw-Wayne Fire Territories CARES program. And now if you scan the logo, it goes to a CARES labeled resource page. And it's got a little blurb about each resource, what it can do, phone number, those kind of things, and how to get a hold of them. So, and Eric has been great to work with, as has 180. We've got Karen Smith out of the fire department's been working that. She's a lot more IT savvy than I am. I can barely turn a computer on, so she helps us with that kind of stuff. And it's been great. So yes, certainly a big thank you to Fellowship Mission and Eric over there. That's just one of the many partnerships that we've developed as we're moving forward. We've got great people helping us out. So this is not an I or even a we for the fire department. It's a we as a community that's making this work. So we just need to keep moving forward.
Good comments, Chris. Thank you. Any final thoughts? Chief, any?
Oh, sure. It's
All
going
right.
great. Happy and proud of them.
All righty. Well, thank you. Appreciate the update.
Yes, sir.
Any other matters come before the board? All right. comments or questions from our visitors? Chief Wilson? Good to see you. Once a chief, always a chief, so I heard you call him former chief, he's still a chief. We have our chief, but he's still a chief. So, and again, thank you for all the work you've done with the CARES. I mean, it's really taken off, and no, big thank you to the work you did leading up to this. All right. Well, with that, is there a motion to adjourn?
So move.
Is there a second?
Second.
All right, thank you.
No,
Thank you, sir.